Hello and welcome, my dear friends. I'm Dr. Khavari. Last week, during an appointment, a gentleman in his 70s, a patient I've cared for many years, stayed back after we had finished discussing his blood pressure and cholesterol. He looked at me, hesitated for a moment, and then said quietly, "Doctor, my wife and we haven't been intimate in a long time. I feel like I'm letting her down, but I don't know where to start, and I'm too embarrassed to talk about it with anyone, even you." His story is not unique. In my more than 15 years working in urology and men's health, I've come to realize something profound. Many of us, as we enter our 60s, 70s, and 80s, quietly accept that intimacy in a marriage is supposed to fade away as a natural part of aging. We feel shy, even ashamed to bring it up, too. But I'm here today to tell you something important. Your sexual health and sense of intimacy are just as crucial to your overall well-being as your heart health or your bone health. And talking openly about it with your doctor isn't something to be ashamed of. It's a brave and necessary step toward improving your own quality of life. So today we're going to sit down together like good friends to explore how you can talk to your doctor about your personal life comfortably and without embarrassment. My hope is that after these next 20 minutes, you'll feel more confident, more understood, and equipped with the practical tools to start this very important conversation. First, let's talk about why this conversation is so important. We touched on this briefly, but I want to dig a little deeper because understanding the why gives us the courage to take the how seriously. Many people think of physical connection as something for the young, but I believe that intimacy in our later years carries an even deeper meaning. It's not just a physical act. It's an affirmation of love, connection, and the joy of living. When we are close to our partner, our bodies release a wonderful hormone called oxytocin. You might have heard it called the cuddle hormone or bonding hormone. It's a natural chemical that reduces stress, lowers blood pressure, and creates a powerful feeling of well-being and trust. In a world that can sometimes feel isolating as we get older, this kind of connection is a powerful antidote to loneliness and even depression. It nurtures your relationship, helping you both feel loved, cherished, and less alone on this journey of aging. But there's an even more critical medical reason. Changes in your intimate life can be an early warning sign of other health conditions. Let's talk more about the men for a moment. I often refer to erectile dysfunction as the canary in the coal mine for heart health. It's an old saying, but it paints a clear picture. The arteries that supply blood flow to the male organs are much smaller than the ones that supply blood to the heart. This means they are often the first to show signs of trouble. If plaque is building up in your circulatory system, a condition called atherosclerosis, it will often restrict blood flow to the smaller arteries first. So, if a man starts noticing consistent difficulty with erections, it might be a signal years before a heart attack or stroke might occur that something is amiss with his cardiovascular system. When you share this with your doctor, you're not just discussing a bedroom issue. You are opening a vital window into your heart health. And for the ladies, let's be more specific. The condition of vaginal dryness and thinning tissue after menopause is now medically known as genitourinary syndrome of menopause, or GSM. That's a medical term, but what it means is that the lack of estrogen affects both the urinary system and the vaginal tissues. The tissue becomes more fragile and less acidic. This change in pH balance can make it easier for bacteria to grow, which is why the risk of urinary tract infections or UTIs increases. So that discomfort you might be feeling isn't just a barrier to intimacy. It's a health signal. By addressing it, you're not only reclaiming comfort and pleasure, but you're also protecting yourself from recurrent, painful infections. So please think of this conversation as part of your regular health checkup. It's not separate. It's deeply connected to your overall health. So how does our body change as we get older, and why does it affect intimacy? This is where I want to clear up some of the biggest myths I hear every day in my practice. Myth No. 1. Older people just aren't interested in physical intimacy. Fact. This is perhaps the most common and most damaging myth. The truth is, desire can change, but the need for closeness, touch, and connection is lifelong. Your libido might not be the same as it was in your 20s, and that's perfectly okay. Intimacy in your later years might be less about frequency and more about quality. It might mean more cuddling, more holding hands, and different ways of showing physical affection. But to say the interest is gone entirely is simply not true for the vast majority of people. The desire for connection is a fundamental human need. Myth number 2. Intimacy is dangerous if you have a heart condition. Fact. This is a very common fear, but for most people, it's unfounded. The amount of energy expended during physical activity is often compared to a brisk walk or climbing 2 flights of stairs. If you can do those activities without chest pain or severe shortness of breath, you are likely healthy enough for physical intimacy. Of course, the most important step is to talk to your doctor. They can assess your specific condition and give you the green light, ensuring your peace of mind. For most, it's not only safe, it's beneficial for your heart. Myth number 3. For women, pain during intimacy is a normal part of aging that you just have to endure. Fact, please hear me on this. Pain is common, but it is never normal. It is a signal from your body that something is wrong. Enduring pain leads to avoidance, which creates emotional distance in a relationship. As we discussed, vaginal dryness and thinning are treatable medical conditions. You do not have to just live with it. There are gentle, effective solutions that can restore comfort and make intimacy pleasurable again. Now let's revisit the changes and, more importantly, the solutions. For you gentlemen, we know testosterone levels drop and circulation can be a challenge. But medical science has not stood still. Yes, there are well-known oral medications, but those don't work for everyone, and they aren't the only option. A doctor can discuss other effective medical treatments, which might include vacuum devices or prescribed injections that can be safe and reliable. Lifestyle changes also play a huge role. Improving your diet, getting regular exercise, and managing stress can have a profound impact on your erectile function. It's about a whole-body approach. For you ladies, when we talk about dryness, it's helpful to know the difference between a moisturizer and a lubricant. Lubricants are used right before intimacy to reduce friction. They are a great first step. Vaginal moisturizers, however, are used regularly 2 or 3 times a week to help restore moisture to the tissues themselves. Beyond that, there is local estrogen therapy. These are not the high-dose hormone pills of the past. These are very low-dose creams, tablets, or rings that are applied directly. They work right where they're needed with minimal absorption into the rest of the body, making them a very safe option for most women. And don't forget pelvic floor physical therapy. A trained therapist can help you with exercises that relax and strengthen the pelvic muscles, which can significantly reduce pain. And for both men and women, remember the role of the mind. The stress, the worries, the grief, the self-consciousness about our changing bodies. These are real. Sometimes talking to a therapist or counselor, either alone or as a couple, can be the key that unlocks the door. It creates a safe space to discuss fears and reconnect emotionally. That emotional connection is often the foundation for physical intimacy. The most important thing I want you to remember is this. Most of these changes have solutions, but your doctor can only help if they know what you're going through. Now let's get to the main part. How do you actually start that conversation in the easiest way possible? Method 1, write it down. This is my top recommendation because it bypasses the initial awkwardness. Before your visit, take a pen and paper. Be specific. Instead of just personal problems, try. For the last 6 months, I've noticed my erections aren't as strong as they used to be. It's become painful for me to be intimate with my partner. It feels like a burning or stinging sensation. I find that I have very little interest or desire for intimacy lately, and it's starting to worry me and affect my marriage. Having it written down feels official. It makes it a legitimate health concern, which it is. You can hand the note to the nurse during intake or directly to the doctor and say, "I'd like to make sure we have time to talk about this today." Method 2, use a conversation starter. Let's practice a few more of these. Doctor, I know my health is more than just my blood pressure. There's something else affecting my quality of life I'd like to discuss. I saw a program on TV about senior health and it made me think, could we talk about intimacy? The medication approach is excellent. I'm about to start this new medication for my cholesterol. Can you tell me if there are any side effects I should know about, particularly regarding my personal life? Deets. Method 3. Link it to another symptom. While discussing arthritis. With the pain in my hips, some activities have become difficult, including being close to my husband. Are there any suggestions you have? While discussing post-prostate surgery recovery. I'm recovering well, but things are different now in the intimacy department. Is that normal, and what can I expect? Method 4. Choose the right moment. This is about finding a space in the appointment where you feel most comfortable. Often after the physical exam is done and you are both sitting and talking is a perfect time. Use that closing line. Before I go, there's one last thing on my mind. It's a bit sensitive, but it's important to me. Now, what should you expect from your doctor? A good doctor will not be dismissive. They should listen. They will let you explain the problem without interruption. Ask questions. They will become a health detective. They'll ask about your medical history, the medications you take, your lifestyle, and your relationship. These questions are not to be nosy. They are to get the full picture. Perform an exam or order tests. They might check your blood pressure, listen to your heart, or order blood tests to check hormone levels, blood sugar, or cholesterol. This is all part of finding the root cause. Discuss options. They should lay out potential treatment paths from lifestyle changes to medications, to referring you to a specialist like a urologist, gynecologist, or a therapist. And what if your doctor? It's rare, but it can happen. If you bring up a concern and your doctor says, "Oh, that's just part of getting old," you have every right to gently push back. You can say, "I understand that changes happen with age, but this is affecting my quality of life and my relationship. And I'd really like to explore if there's anything that can be done to help." If they still don't take you seriously, it is perfectly acceptable to seek a second opinion. You are the advocate for your own health. To help you picture this, I want to share the story of my patient John again, and also tell you about another patient, Mary. You remember John? He came to see me about waking up at night to use the bathroom. After we solved that, he bravely brought up his issue with intimacy. He felt like he was failing his wife. We had that open conversation. We discovered his blood pressure medication was a major factor. We switched him to a different class of drug that was less likely to have that side effect, and talked about the importance of daily walks. A few months later, he returned, held my hand, and said, "Thank you, doctor. You didn't just treat my condition. You helped us find a connection we thought was lost." Then there was Mary, a vibrant woman in her late 60s. She came in for a routine checkup, and I could tell something was weighing on her. She finally confided that she and her husband of 40 years felt like they were drifting apart. She had been avoiding any physical closeness because it had become intensely painful for her. She was ashamed and secretly worried her husband thought she didn't love him anymore. We talked, and I did a gentle exam. It was a classic case of postmenopausal vaginal atrophy. I explained it to her in simple terms that it was a physical change, not an emotional one. I prescribed a very low-dose local estrogen cream. She was hesitant at first, worried about hormones. We spent time going over the safety of it for her specific situation. 2 months later, she came back for a follow-up, and she was like a different person. She beamed and said, "It's like night and day. There's no more pain. But the best part, my husband and I are talking again. We're holding hands. We feel close again." She said the real cure wasn't just the cream. It was the conversation that allowed her to understand her own body and share that with her husband. These stories prove that one small conversation can truly change everything. So let's quickly summarize the main points. First, your intimate health is an inseparable part of your overall health and quality of life. It's about connection, well-being, and joy, and it's a key indicator of your physical health. It is not frivolous or shameful. Second, the physical and emotional changes we experience are real, but they are not the end of the story. Acknowledge them, but don't surrender to them. From lifestyle adjustments to modern medical treatments, there are so many solutions available. And third, and most importantly, you absolutely can start this conversation with your doctor. Prepare yourself. Write it down, practice a starter sentence, and know that you are taking a courageous and powerful step for your own well-being. The message I want to leave you with today is this: you deserve to live a life that is full in every aspect, and that includes intimacy and connection. Don't let silence or embarrassment rob you of your joy and your health. A courageous conversation today can be the beginning of happier, healthier tomorrows. I truly hope that our talk today has brought you some comfort, confidence, and a little bit of courage. Health is a journey, and it is my honor to walk alongside you on it. If you found this video helpful, please take a moment to click the like button and subscribe to my channel. It helps ensure that important health messages like this can reach more seniors in our community. I wish you the very best of health. May you always keep your spirits high and find joy in the loving connections in your life. I'm Dr. Rose Khavari. Be well, and I'll see you in the next episode.